Removal of the appendix, called appendectomy, is performed when appendicitis is suspected. Right lower abdominal pain, fever, and elevated white blood cell counts are common symptoms and signs of appendicitis, which usually occurs when a blockage develops between the appendix and the intestine. This leads to infection, swelling, and distension. If the appendix is not removed, it can lead to a life-threatening perforation or rupture. The only treatment for appendicitis is appendectomy, which is almost always performed on an emergency basis. New laparoscopic techniques require only tiny keyhole incisions or puncture wounds, which generally results in a shorter recovery period. An uncomplicated laparoscopic appendectomy usually takes between 20 and 30 minutes. To gain access to the appendix, the surgeon will use sharp instruments called trocars to create 3 small holes or ports through the abdominal wall. These ports are usually located at the umbilicus and in the upper right and lower left quadrants of the abdomen. Carbon dioxide gas will then be pumped through the umbilical ports to puff up the abdomen so its contents can be viewed more easily. Next, the surgeon will insert a laparoscope through the abdominal ports. Images from its camera are projected onto a video monitor in the operating room. The surgeon will carefully examine the insides of the abdomen, confirming that the appendix is raised, swollen, and needs removal. At this point, the surgeon will pass surgical instruments through the other 2 ports, grasp the appendix, separate it from the intestine, drop it into a specimen bag, and remove the specimen bag through one of the ports. After the appendix has been safely removed, the surgeon will instill warm sterile salt water through one of the ports into the abdomen to cleanse the abdominal cavity and remove any traces of infection. The salt water is then suctioned out. Before removing the laparoscope, the surgeon will take one final look around for areas of bleeding or other damage. When the laparoscope is removed, a port valve is left in place briefly to allow all the carbon dioxide to escape from the abdomen. Finally, the keyhole incisions are closed with sutures or staples and covered with bandages.